Morning Pathophys, Monday morning, April 13th, and I realize we don't technically have school today. Filming this, I'll probably post it later today. You have this week, just to kind of summarize, your project is due tomorrow evening. I'm looking at some of them already. They're looking really good. Keep it up. Keep up with good work. Let's get them all turned in like we did last time. And I have it on Wednesday for the schedule that we're having an assessment. It's probably going to be Thursday where I'll have it due. I'll probably post it on Wednesday morning or maybe even tomorrow morning. So those of you that are done with your projects can start looking at it. Not going to be anything out of the ordinary. I think last assessment was 4 or 5 questions. This will be similar. The chapter that we're on, obviously, is the muscular system. I know that might be a little confusing because your project's on autoimmunes. Not that there's not enough muscular disorders to do. It's just that typically this time of the year, autoimmune disorders, something that we'll discuss and spend some time on as we're doing the muscular system. So since we're not in class, not in school, it's hard to explain that to you, but that's what we're doing. I'm hoping that you learned a great deal about doing or about researching autoimmune disorders as those become much more prevalent in society, especially in countries where we have more what they would call modern medicine. And there's a lot of reasons for that. I hope you dug some of those up. A lot of theories rather, not a lot of reasons as to why that's happening. Hopefully you encountered some of those when you're doing your research. All right, so let's finish up this chapter and look at the end of the chapter, which discusses specifically muscle disorders. General name for those are myopathies, which makes a lot of sense. Obviously, pathos, myo, muscle sickness or muscle disease. Some general categories. Some of these are a little more general than others. Some of them don't refer to specific diseases. Myositis, some muscle infection or inflammation. Myalgia is muscle pain, not necessarily disease, but sometimes a characteristic of diseases that involve the muscular system, not sometimes primarily. Strain versus sprain, which I asked you on a question already. A muscle strain is just that. It's when you damage muscle fibers within a muscle body or muscle group. Damage could be tearing them, it could be rupturing them. These are individual muscle cells. The thing about muscle tissue is it doesn't typically grow back or heal that well, and usually is replaced by some form of connective tissue. So a lot of muscle damage over a period of time, connective tissue, loose, dense connective tissue replace functional, contracting muscle tissue, which is obviously not a good thing. So if you're a younger patient, somebody who is involved in athletics, if you have a muscle injury, you really have to go through some intensive rehab to get that back. Unfortunately, older people, typically muscle injuries and muscle damages, strains become cumulative, and you lose functionality in the muscle. It becomes less powerful, less strength within that muscle. A sprain involves ligaments, right? A ankle sprain has nothing to do with muscles at all. We address it here because these two terms are used interchangeably and incorrect in a lot of cases. So a sprained ankle involves a ligament injury, something that holds bone to bone. Strains muscle, sprains ligaments. Tenosynovitis, just like the word sounds, it involves the tendons, so the muscle tendons themselves. When you talk about somebody who has carpal tunnel syndrome, that is typically going to be the issue with tenosynovitis. So tenosynovitis is typically going to be the underlying cause. It's inflammation, swelling in that sheath that surrounds the tendon that allows the tendon to slide inside of it. There's synovial fluid in there too, and then it just becomes encumbered, I guess is the best word. Just quick explanation, I've spoken to people before who've had tenosynovitis in their Achilles tendon. You can literally feel the tendon kind of pulling and squeaking and almost catching as you try to dorsiflex and plantar flex with the foot. So just understanding what that is. Fibromyositis, this involves a tendon and the muscle, usually due to injury. It's an inflammation again. And then cramps. Big words and then this simple word here. But what is a cramp? That's probably going to be a good question for your test. I might ask you that. A cramp involves an improper contraction of the muscle, a twitch, as I referred to in the last lecture, fasciculation. And there's a number of things that cause cramps. And so I think as I say that right now, that's probably going to be a good question to look up. What is a cramp? What does it mean to have a cramp in your calf or in your thigh or in your biceps? So take a peek at that and make sure you understand what that means. All right, some infectious muscular disorders, influenza, trichinosis, and poliomyelitis, flu. This one you're probably not as familiar with, although we did discuss that in class briefly, and poliomyelitis. Influenza causes a number of symptoms and signs, one of them being muscle fatigue and pain, myalgia. Different reasons for this could be the dehydration, could be the virus itself attacking the muscle tissue, so it causes some muscle pain. So influenza or muscle pain is often linked to influenza in addition to the respiratory issues and dehydration and other things that go along with having the flu. Trichinosis, it's a nematode infection. It's from eating undercooked meat, typically pork. It's almost been eradicated. You don't hear of too many cases anymore. Basically what happens is this nematode insists itself through its life cycle in skeletal muscle fibers. And when you consume that meat, if it's undercooked, then you obviously get the infection. It makes its way through your bloodstream. It's a very small nematode, tiny little one. And what the body does is puts a calcium cyst around it. And cumulatively, if that occurs and it's not treated, then you basically are hardening your muscle. You're going through a process in which your body's protecting yourself, but in the same time causing some damage, some ancillary damage. I think I mentioned in class that a lot of times it likes to settle in the diaphragm, which obviously is a problem if you're trying to breathe, if your diaphragm's becoming calcified progressively. So trichinosis from eating undercooked meat, and it's a nematode infection. And then poliomyelitis, viral infection that's been eradicated in the United States. Back in the 50s, Jonas Salk, he's getting a lot of press right now because he came up with the vaccine for that basically changed the lives of people your age and younger. Poliomyelitis had a lot of issues. Obviously it could cause death, but the lasting issues of people who had polio, which is partial paralysis, limbs, lower body, depending on how severe it was. It was a major fear factor. 1950s and earlier to get polio when there were polio outbreaks. So that vaccine, hopefully we'll see the same thing for COVID-19, where they develop a vaccine for that as well. What does it do? Again, it attacks the nerve endings that innervate the muscle tissue. So if you have no connection to the muscle tissue, then you can't get it to contract. It's that simple. It causes paralysis. So those are infectious muscular disorders. Last two don't fall under any of the categories. Muscular dystrophy, this is a genetic disorder. There are 7 or 8 different types. The one that I typically focus on in lectures, Duchenne, which is the most severe type. This is an X-linked disorder, which means the mother will be a carrier for it. She'll have one healthy allele on her 1X chromosome, which allows her to produce the protein dystrophin, hence the name muscular dystrophy. Dystrophin is a binding protein inside the muscle fibers. It basically holds and anchors all the muscle tissue together. Actin and myosin, again, being the contracting fibers, but dystrophin holds it all together. It gives it an anchor, a base, a foundation. So without the production of proper dystrophin, the muscles degenerates over time. With Duchenne, it happens quickly. You typically see signs in the child before they reach 1. And it's usually fatal by 25. That's typically the course that it runs. It's a horrible disease. No cure for it. Treatments, even though there's a ton of research being done on MD, there's really nothing to do except for to try to slow down the progression a little bit. So that's MD. It's a genetic disorder. And then the last one, myasthenia gravis. Myasthenia gravis is an autoimmune disorder. I don't know if anybody picked that one or not. I haven't looked at the list that carefully. In myasthenia gravis, your own white blood cells attack the muscle at the neuromuscular junction, which is something I asked you about last week. That is the point in which the nerve innervates with the muscle tissue. That's the connection. That's, if you want to think of an appliance, it's where the cord attaches to the appliance. So this disease, your white blood cells attack that connection point. So same basic effect here. You don't have nerve impulses reaching the muscle effectively or at all. Myasthenia gravis is episodic. It can be progressive. It's treatable with immunosuppressing drugs, but obviously that, as you probably found out through your research, has some other side effects as well when you suppress your immune system. So people right now that are on immunosuppressing drugs because they have autoimmune disorders like lupus or MS or myasthenia gravis are in that group of people that are high risk because their immune systems cannot properly deal with another infection, or won't fight it off as effectively if they weren't taking those medications. So myasthenia gravis typically affects the muscles of the face, sometimes even the extrinsic eye musculature. I had a student who had this disease about 10 years ago, and the first thing he noticed is his one eye. He couldn't move his one eye. So his one eye, he thought he had a lazy eye, and then turned out it was the beginning of this disease. They did get him on some medication, and he recovered. I haven't talked to him in a few years, but I think he's been in remission since then. So again, myasthenia gravis is an autoimmune. This is genetic. These are infectious, and these are general terms. Take a peek at your notes once you finish with your project, and be prepared for, again, probably 4, 5, 6 questions relating to Chapter 8. Have a good day.